Hey everybody, Dr. James Fetich here, Clinic Director at Village Family Clinic in Allenwood, New Jersey. We're here to talk to you about a bulging disc. We're doing our frequently asked questions. One of the frequently asked questions we get here is, can chiropractors treat a bulging disc? So before we answer that, we're going to explain to you what a bulging disc is. So in our back, we have 26 bones or vertebrae, and this is looking at the vertebrae from the sides. This is the part of the back that you can feel those little bumps, and your belly kind of would be up here. So the bones or vertebrae are separated by something called a disc, and I tell patients think about it kind of like a jelly donut. It's a little bit squishy, it does our shock absorbing, and like a jelly donut, it's kind of liquidy in the middle, and it's held together with some fibers on the outside. So it's the easy way to think about a jelly donut. So a lot of things can happen to discs. We're not going to get into disc herniation, disc bulge, but the disc can get injured in multiple ways. A lot of times as we get older, that jelly starts hardening or drying out, and some of the jelly can bulge out where it's the jelly still in the donut, but it's pushing out a little bit. Or technically when it herniates, the jelly's coming out of the donut. The disc is a unique part of the human body. It's the only part of the human body that has no nerves and no blood supply. So what that means is the disc doesn't hurt. So you hear people say, I slipped the disc. The disc itself isn't what's hurting. It's only if it hits the nerve. So in our little model here, it's here to show the disc bulging out or herniating out and it hitting the nerve. But the disc can bulge or herniate out, but if it doesn't hit the nerve, you don't feel it. So a lot of times people come into our clinic in pain. When we do MRIs and evaluate, we find out the disc has been in there for a while, but it's only just recently started to hit the nerve. So the body's kind of protecting you there. The disc is only going to bother you when it starts hitting the nerve, which is good or bad, I guess. But once it hits the nerve, it causes a lot of pain to a lot of people. The nerve's soft and sensitive. It doesn't like the disc rubbing on it, and that can cause a lot of discomfort. So a small herniated disc or bulging disc can be treated with chiropractic physical therapy really successfully. Some of the more moderate to severe ones, we have more advanced methods for it. So sometimes if that disc is really sitting on that nerve, doing a lot of physical therapy exercise or chiropractic adjustments can actually aggravate it because it's inflamed, it's being rubbed, and now you're exercising, adjusting, and it might aggravate it worse. So what we typically do here is we have spinal decompression therapy, and that's where we have the spinal decompression or traction tables, which are able to open up that space and get the disc to create a negative pressure and come in a little bit. So I tell people, of course, we're not going to make your disc like it look like it was 10, 15 years ago, but if we can suck a little bit of that disc off that nerve with the decompression therapy, it'll create all the relief that you need because the body only knows if it's hitting the nerve or it's not. So if right now the nerve is being hit and we pull that just a little bit off, you'll feel complete relief. So spinal decompression is very successful. Disc bulge, disc herniation is about 85% success rate. It's higher than surgery, injections, any of that kind of therapy, which we do injections here as well, but non-surgical spinal decompression was the best method around to treat disc herniations, disc bulges. We have 2 tables here, always available 9 to 7 for you. So if you have disc bulge, disc herniation, you think something that you might be able to help us out with, that we can help you out with, give us a call, 908-813-8200, or go online at Hackettstownfamilyclinic.com.